everyone. Thank you for joining us. And as Kiyomi said, I'm the program assistant for the Family and Community Engagement Program over here at Center of Life. And just thank you for joining us.
So like I said, we're really excited to have Dr. Tiffany Hatcher with us. We're going to be going over underlying medical conditions that put individuals at increased risk for developing COVID-19. We're also going to be talking about administration and dosing of the Moderna and Pfizer vaccines, as well as common myth and facts about both vaccinations and education on reliable resources for that information. We did get some of your questions and concerns ahead of time, so that was sent off, and so we'll be addressing some of those. Now, if you have any other questions that come up while you're watching this, please feel free to use the Q&A section to type up those questions and let us know. We'll also be monitoring the Facebook Live session. So if those of you at home that are watching on Facebook, we'll be monitoring that chat to see anything that's going on there. Dr. Hatcher is the Community Pharmacy Concentration Coordinator at Duquesne University. She is a trained pharmacist provider within the Pennsylvania Pharmacists Care Network, and she brings a variety of diverse experiences in teaching, training, and providing pharmaceutical and patient care services. She has a passion for impacting patient care on a national level and ensuring pharmacists and student pharmacists are equipped with tools to better serve patients. So thank you so much for joining us, Dr. Hatcher, and we'll go ahead and begin.
Hi, good evening, everyone. So thank you so much for that lovely introduction. A little bit about myself. I am from Alabama and actually relocated to Pittsburgh only about 2 years ago for the opportunity at Duquesne. I am a graduate of Hampton University School of Pharmacy and have worked in numerous roles since graduation across several different states. And so I'm excited to be here in Pittsburgh and getting to know the area and hopefully getting to know some of you all as well. As Kiyomi mentioned, today we're going to have a COVID-19 edition of Ask the Pharmacist, and we're going to cover several objectives, but the primary goal is to answer the questions that you have primarily about the COVID-19 vaccine, and to also share some additional factual information for everybody, and also to share some resources so that everyone, if you're interested, can look up additional information for yourself. So please don't be shy of the questions. I will say that the COVID-19 vaccine landscape is changing daily. Even as soon as yesterday in terms of the CDC making updated recommendations on their website. So there may be questions that I don't have answers to, and that's just simply due to the changing landscape. However, I can take those questions and do additional research and follow back up as needed. All right, so let's get started. So our objectives today, we're going to first look at those key medical conditions that put people at risk for developing COVID-19. We're going to look at safety and efficacy data. So really answering those two big questions of, is it safe and does it work? And we'll look at some common myths and also talk about some facts about both of the vaccinations. We'll then transition into looking specifically at the Moderna and the Pfizer vaccine administration schedule. So how do you actually have it administered? How frequently is it administered? And how well it works. And then lastly, we'll look at reliable sources of information for both vaccines. And then, as I said, we will definitely leave time for some Q&A if you all have any. And as we go through, I will also be plugging in some of those questions that we had submitted during registration, and also asking some poll questions for individuals attending via Zoom. If you could answer the poll questions, and if you are attending via Facebook Live, if you want to share your answers into the chat, that could be good as well. So one of the first poll questions I have for you all, and this is just going to help me get to know a little bit more about the people attending the webinar tonight. And I'm going to go ahead and launch it. It's, how frequently do you receive the annual flu vaccine? And the reason I'm asking this question is because I'm curious just to see, out of the people we have joining, do we typically get the flu vaccine? Are we hesitant to get the flu vaccine so we never get it? Or are we, sometimes we get it depending on our schedules, other times we don't. So COVID-19 vaccines are not the first vaccines on the market, and I understand and recognize that a lot of people have safety concerns about all vaccines. And so with the flu vaccine being one of the more common ones, I just want to, seek to understand how frequently individuals are getting that vaccine. We'll leave it open for about another 5 seconds and go ahead and close it. Okay, and so I'm sharing the results. So looks like we've got about 44% people always get the flu vaccine, sometimes get the flu vaccine, another 44%, and 11% never getting the flu vaccine. And so people have various reasons as to why they always get it or as to why they never get it. And so hopefully, some of those safety questions or efficacy questions as well, we can talk about through tonight's presentation. All right, so our first one, we want to understand why or who is at an increased risk for developing COVID-19. We always hear that sometimes these Black and Brown communities have a higher risk, but what are some of the specific disease states or specific behaviors that may be putting us at higher risk for developing COVID-19? So here we have several different disease states. So type 2 diabetes, which we know is very prevalent in our communities. Patients with high blood pressure. So there is an asterisk there because currently they are collecting more data to affirm this one, but there is this prediction that high blood pressure will also increase a person's risk for developing COVID-19. Patients with chronic obstructive pulmonary disease, so that chronic lung disease puts us at risk along with anyone who is an active smoker. So definitely there are a lot of health benefits when we talk about transitioning to a healthier lifestyle, increasing our activity or physical activity, stopping smoking has a lot of benefits overall with these disease states, but it also can help decrease that risk for developing COVID-19. Individuals with pregnancy or are currently pregnant, along with individuals with a sickle cell disease diagnosis, are also at a higher risk. So I know that these are pretty big categories. And so I have a question for you all. How many of you all know somebody who may be at increased risk for developing COVID-19? And so I'm going to go ahead and launch a poll. So just think about individuals you know in your community. Think about yourself. Are you yourself potentially at an increased risk? We'll leave it open for a few more seconds. And once again, you may be wondering, well, why would I ask this question? And I think oftentimes when we see things that hit home, when we are able to reflect and understand that this isn't affecting only the outside community or only individuals who I don't know, but this could be affecting my mother, my brother, my cousins, my aunties. This is something hitting close to home. And so we want to be knowledgeable and understand that our actions and behaviors have a direct reflect and a direct impact on those who we love right now in this community. So 100% of people who answered the poll currently know somebody who is at an increased risk. And I personally, knowing individuals at an increased risk, I'm more concerned about them. And that impacts the way I behave, the safety precautions I take, because I certainly don't want to put anybody who's currently at an increased risk at a greater risk, honestly. So understanding that most of us, if not all of us, know somebody who's at an increased risk, it kind of lays that foundation of if we can utilize a vaccine to help mitigate and decrease the transmission of developing COVID-19, overall, it could be positively impacting at least one person each one of us know, if not positively impacting ourselves. And so now we're going to transition and look at some of the safety and efficacy data, but really understanding, is it safe? Do these vaccines work? How are they developed? And we'll take some time and answer some questions once again about some things that could be perceived as common myths. But really, when we think about people who are hesitant to receive vaccines or individuals who may be hesitant about the COVID vaccine, usually it's out of a strong concern for safety. Ultimately, we want to keep ourselves safe. We want to keep our family safe. We want to keep our community safe. And so if we don't believe something is going to be safe and effective for us, we're definitely less likely to engage or receive that product. So we're going to spend quite a bit of time looking at that. But first, I have, once again, a couple more COVID questions. So I want to hear from you all regarding your initial impressions of the safety. I want to hear from you all regarding the initial impressions of if you've had COVID-19 and you've essentially recovered from it, you know, do you still need to get this vaccine? Understanding or asking the question of if I have COVID, if I receive the COVID vaccine, you know, am I going to become infected with COVID? Could I potentially get sick and get COVID from receiving the vaccine? So I'm going to go ahead and launch these questions for you all to take a few moments and answer. And once again, your answers to these questions will allow me to craft and provide information that will be most useful to the attendees who are on the call tonight. All right, we'll give it about 5 more seconds. Let everyone lock in their answers. All right, and so I will go ahead and share the results. So everyone should be able to see that. So it looks like there are some mixed feelings towards whether or not the COVID vaccines are safe. So in the next slide, we'll talk about what exactly the 2 COVID-19 vaccines that are on the market, what are they and how do they work? Concerns around whether or not you will catch COVID-19 from receiving the vaccine. We'll spend some time talking about that as well. I'm looking at if you've already had COVID-19 that you do not need the vaccine. So we have some individuals in that unsure category, so we'll be sure to touch on that one. Along with looking at how does COVID-19 affect pregnancy. So that's a really big concern for a lot of individuals. And so we'll be sure to talk about that as well. So thank you for your participation in the poll questions. All right. So what is the COVID-19 vaccine and how does it work? So when I say what is the COVID-19 vaccine, right now I am referring specifically to Moderna and Pfizer vaccines. In the next couple slides, we'll look at some other vaccines that are currently in process of submitting paperwork for authorization. But right now we have 2 that are on the market that we are looking at. So these vaccines are known as mRNA vaccines. And basically what they are, it takes a piece of this spike protein that is on the COVID-19 virus. And it pretty much, we are administering that into our patients. And that spike protein produces, reproduces that protein once again and allows for antibodies in the body to be produced against coronavirus 19. So when we think about it, we're taking a piece of the virus. So we're not taking the entire virus and injecting it into individuals. We're taking a small piece of it. And that small piece is replicating and allowing your body to understand the virus and to also build an immune system against it. Once this has been completed, your body can now, upon coming in contact with the coronavirus in the environment, it can recognize it and mount that immune response that it's already developed, within your body. So essentially, we are preparing your body to potentially come in contact with COVID-19. Now that your body has been prepared, if you were to come in contact with it, it then is able to set up those defense mechanisms and fight the virus off, so you do not become infected, or it reduces your chances of becoming infected. So how did we get here? So there are a lot of concerns about the speed at which these vaccines were developed and the process that they were approved through. So there was a clinical trial testing process, and this clinical trial process is something that is standard across all medications and vaccines that are submitted for approval. One thing that was different is these vaccines received what is known as an emergency use authorization. So once the vaccines completed phase 1, so they took a small number of healthy individuals, and they used these individuals to test the vaccines for safety, and to determine what might be a safe dose for a person to receive. And so when I say dose, I'm talking about the quantity of the vaccine. So are we going to give you 0.5 milliliters? Are we going to give you 0.3 milliliters? So what is that dose that is both effective but also safe for individuals to receive? In phase 2, we branch into a larger number of individuals. And at this point, we've determined that it's safe in people, but we really are now looking at the efficacy. So answering that question of, does it work? Does it reduce transmission rates of individuals catching COVID-19? And what are those side effects that people may experience after they receive this vaccine? And so as they do the phase 2 trials, it's once again understanding what is the best dose that has the least number of side effects that we can tolerate within a patient population. Once phase 2 has completed and a company has gathered all of that data, it then transitions into phase 3. And phase 3 is a much wider patient demographic. And so when we get to phase 3 trials, we're looking at thousands of individuals who are signing up to volunteer and who are essentially receiving the vaccine, being monitored at that time and reporting back and getting those tests to help determine, once again, is it effective? And then also comparing it to other medications or other treatments on the market if there are any. So we know coronavirus, it's unique in that, prior to the COVID vaccines, there were very few approved FDA medications for treatment. We really were in that symptom management. Once somebody has been infected, how do we reduce their symptoms and how do we ensure that it doesn't develop or exacerbate into something far more serious. But we didn't have any medications that were specifically indicated to treat COVID-19. And so in order for a product to get an emergency use authorization, it has to be treating essentially a disease state or a condition that has been seen as deadly or has been seen as completely negatively impacting the patient population as a whole. Additionally, we're looking to see, is there anything else on the market that can effectively treat this disease state or condition? And so at the time of the COVID-19 vaccine development, we really didn't have much on the market that we could confidently say this product treats the COVID-19. And then lastly, it's this risk benefit ratio. So the FDA looks at what are the risks of an individual receiving this vaccine versus the benefits. And so the vaccine companies are submitting all of their information, and the FDA actually holds a public meeting to review all of the safety data and all of the efficacy data to understand that risk benefit ratio. So ultimately, we want to make sure that we have a high benefit with a minimum risk. And so with the current Moderna and Pfizer vaccines, that is what the FDA found in their meetings. They found that based on the data that we have right now, there is an increased benefit for an individual to receive these vaccines and a much lower risk of them receiving these vaccines. So there are oftentimes a lot of questions right now around long-term data. So since this authorization came so soon, less than a year almost, since we have officially been quarantining, we have vaccines on the market. That's much quicker than many of the other vaccines that we do have on the market. And so there's a lot of valid concerns around long-term safety. So unfortunately, I don't have, 2 or 3 year safety data to present to you. Nobody does. However, when we look at the rest of our vaccines on the market, overall long-term safety data has been pretty clean. So in terms of after a vaccine is approved and it's starting to be administered, the CDC and the FDA still continuously track for side effects and monitor the patient populations to see, is there anything long-term happening to these patients? Is there anything long-term that we should be concerned about? And overall, many of our vaccines have pretty much passed that test, and there hasn't really been an indication for us to be concerned about the long-term safety data. So that is kind of what we're going off of. We're looking at the previous experiences that we've had with our vaccines. If we think about all the childhood vaccines that individuals are now receiving, 20, 30 years later, we're not seeing those negative side effects or any really negative side effects in that long-term safety data. And so we're taking that understanding of the process that those vaccines were developed and really applying it to these COVID-19 vaccines. So there was a question that came in the chat, and it is, can someone who got the vaccine still transmit COVID-19? And so I'm going to touch on that in a moment, but I did want to spend some time on the clinical trial testing phases. So I touched on this a little bit. So concerns about the vaccine development. The first one was the time. So as I said, it felt like less than a year, and these vaccines were on the market in December of 2020, and that was a red flag for some people. But what we have to understand is these mRNA vaccine studies have been conducted over the last several years. So individuals have been looking at this technology consistently over the last several years and designing a strategy for these vaccines to work. Of course, we didn't have coronavirus at that time, but we have several different things in our communities, such as HIV, such as Zika, that individuals are working around the clock to attempt to create vaccines for. So we already have a lot of technology. Once coronavirus came onto the scene, it was taking the technology that we currently have and adapting it to this current disease. And so individuals were able to do that relatively quickly since the technology was already created. Once again, when it looks at safety, the FDA does review all of the safety data. Additionally, all of the safety data is publicly published for individuals to go and look at. As I mentioned, these FDA meetings are actually public as well. And on Friday, there's going to be another one to assess another vaccine potentially coming to the market. And I'll mention that again in a few moments. When it comes to those long-term side effects, it's not like the vaccines receive approval or receive authorization and then nobody tracks anymore. There's continuous check-ins to try and follow up and understand, are there any serious or long-term effects of individuals receiving this vaccine? Currently, the CDC has an app that they're utilizing to track our COVID vaccines, and we'll talk about that app in a little bit as well. The last unique thing that was seen with the COVID vaccine development is the number of sheer resources that was redirected to the COVID-19 vaccine development. There was international collaboration amongst organizations and companies and individuals trying to work their best to develop these vaccines. Additionally, there were multiple funding sources. So oftentimes a limitation in the medical world and why we're so slow sometimes with getting new medications and vaccines to the market is funding. And so we were able to have funding from multiple sources, government sources, private entities, manufacturers. There were so many different people willing to come together and fund these studies, which made it possible to bring them to market much quicker. And then the last resource, which is critical, were our volunteers. So we actually had a large number of individuals who were willing to sign up to volunteer to make these studies and these trials successful. You will find that if we don't have volunteers, it makes it really difficult for us to study and test these vaccines or any other medication and determine if it's efficacious or if it doesn't work in the patient population. So definitely we had a large number of people who volunteered for that, and we really do thank them for doing it for us. So moving into the administration and dosing schedule. So we've talked a little bit about the process that the vaccines went through to come to the market. So we understand that it went through that safety and efficacy data. Those phase 3 data were collected to understand, does this work? And we'll look at those numbers in a little bit. And we know that right now the CDC is continuously collecting information from individuals who have received the vaccine to understand, are there long-term effects? And they will continue to do that for years to come. So eligibility and administration. So right now we have these 2 vaccines on the market. So we have the Pfizer, which has been approved for adults 16 years and older. And they are currently looking at doing studies between the ages of 12 and 15 to continue studying if it's safe, does it work, and what is the optimal dose for an individual in that age range. Right now, for individuals 16 and older, it's a 0.3 milliliter intramuscular dose, and you have 2 of them separated by 21 days. So what does that mean? It's 0.3 milliliters. An IM dose is going to be in this upper deltoid muscle of your arm, and it can be administered in either your left or your right arm. You're going to have 2 doses, 1 dose on your first day, and then 21 days later, you're going to have to get your second dose. So there have been some questions about, does it have to be on the 21st day? What happens if I miss my 21st day and it's on the 22nd day? Or can I get it sooner than those 21 days? So to answer some of those questions, if you're unable to get scheduled on that 21st day, you actually can have your vaccine up to 4 days early as recommended by the CDC. So right now, looking at the Pfizer vaccine specifically, right around that 17-day benchmark up to 21 days is where you're starting to see a lot of clinics scheduling patients to start getting their vaccines. Now, the question of what happens if I'm on day 22 or day 23 and I have not received my vaccine? So honestly, you are still eligible to receive your second dose. Really, our goal is for you to get that second dose as quickly as possible, but there is no need for you to restart the series. So if you miss that 21 days, there's no need for you to get an additional 2 doses or anything of that nature. You're really just trying to get your next dose as quickly as possible. In terms of receiving your second dose, it's really important that you maintain a relationship with whatever pharmacy or entity that you received your first dose from, because oftentimes they're going to then be the ones that you will be able to get your second dose from. In terms of does it work? So the Pfizer vaccine is seen to be 95% effective. And so what do we mean by effective? When we looked at 2 groups of individuals, one group who received the COVID-19 vaccine of Pfizer's, and one group that did not receive the COVID-19 vaccine, we saw that the group that did not receive the COVID-19 vaccine had a much higher rate of individuals catching COVID-19. However, the group that received the vaccine had a much lower rate of individuals becoming infected with the COVID-19, with coronavirus or COVID-19. So this question of, if I have received the vaccine, is there still a possibility that I can transmit? So yes, there is. So a couple of things that we look at. If you received the COVID-19 vaccine today, but perhaps you were already infected with COVID and didn't realize it, there's still a potential that you have the ability to spread COVID at that time before you're fully protected from the vaccine. Additionally, if you receive the COVID-19 vaccine today, you don't automatically get supernatural powers and become invincible to COVID-19 in that moment. You do need both of your doses plus an additional 2 weeks in order for you to become or reach a level of immunity. So what does that mean? So once you've received your second dose at day 21, it then takes an additional 2 weeks for your body to mount that full immune response and get you to that immune level. So that means any time within that time period, you still may be able to catch COVID. Therefore, you still may be able to spread it to other individuals as well. When we look at Moderna, this one is specifically approved for adults 18 years and older. And this one is a 0.5 once again, intramuscular injection, and it's 2 doses separated by 28 days. Once again, the CDC does have that recommendation that you can get the Moderna vaccine up to 4 days early, if that works best for your schedule. And really after that 28 days, we're really trying to get you the vaccine just as quickly as possible, because the longer we delay you receiving that second dose is the longer you're delayed in getting your protection. And really our goal is to have you protected as soon as possible. When we look at the question of does this work, Moderna has shown a 94% effectiveness. So these are really high effectiveness ratings. If we looked at effectiveness for the flu shot, which we know changes year over year, there are years where the flu shot is 70% effective. And that's something that we've been working on and developing over years. And so the fact that we're able to have something on the market that's 95% effective or 94% effective is really impressive. And it really shows the technology that we have and how far we've come in our vaccine development, research that we have today. For both vaccines, you need to have a minimum of 14 days between other vaccinations. So what do I mean when I say that? So that means if you were going to get a Tdap vaccine, or if you're going to get a pneumonia shot, or if you're going to get a shingles shot, you would need to wait 14 days from when you receive that shot to get your COVID vaccines. And so that's why we're really encouraging individuals that if you're looking at having the opportunity to get your COVID vaccine relatively soon, hold off on those other vaccinations so it doesn't make you ineligible to receive your COVID vaccine. After you finished your COVID vaccine series, whether that's 21 days or 28 days, once again, you would wait your 14 days before you went ahead and received any other vaccine. So once again, if you recently became eligible for that shingles shot, you would want to wait 14 days to go ahead and get that vaccine. I really encourage you to share all of your vaccine information with whatever provider who may be giving you your COVID vaccine, so we can help determine, are you eligible to receive that vaccine today? And is it going to be safe for you to receive that vaccine today? This recommendation to wait 90 days after infection. So there was a question that said, if I have tested positive for COVID-19 and I have pretty much recovered and it's been 90 days, do I have immunity for those first 90 days after I've become infected? And so the question really isn't whether or not you're immune, but really your body still has those antibodies within it. And what we've seen is individuals who get the COVID-19 vaccine within 90 days of their infection are actually having worse adverse effects. And so due to that, there is the recommendation for us to wait that full 90 days after you've tested positive to then initiate a COVID vaccine series. There also are a lot of questions about other vaccines in the pipeline. So we have 3 vaccines right now that are in the pipeline. We have AstraZeneca, we have Janssen's with Johnson & Johnson, and we also have Novavax. And each of these vaccines actually do use some different technology. So it's interesting to see some of this technology that's been studied over the years finally kind of coming to ahead and actually being used, which is exciting to see. One thing to note is Johnson & Johnson's COVID vaccine authorization meeting is actually on Friday. And as I said, these are public meetings hosted by the FDA. And on their website, you can actually find the meeting link to tune in if that's something you're interested in. And during these meetings, you will see Johnson & Johnson present a lot of their safety data along with a lot of the efficacy data. You will see individuals from the FDA on a panel ask individuals from Johnson & Johnson very specific questions about the vaccine that they are proposing for authorization. And Johnson & Johnson will basically have to defend and provide information to the FDA and to the public about the vaccine that they are proposing for authorization. If you've ever seen one of those meetings, you will find that it's not an easy process for these vaccines to gain approval. The FDA actually takes a lot of time going through all of the data and asking all of these very pertinent questions, to Johnson & Johnson, to any other manufacturer who is presenting a vaccine for approval. It's interesting that you also get to see the FDA members of the committee vote live on whether or not they want to approve the vaccine. So you'll see all the members on the committee actually casting their vote and having discussions about whether or not, an individual is for the authorization or against the authorization. So definitely, I would say rest assured in knowing that these vaccines are not getting blanket approvals, overnight. These are things that are taking time and having a lot of discussions and a lot of data analysis to make sure that it would be for the greater good for the population and not, at a risk or harm for the population. Additionally, there are a lot of questions about variants, and this is something that we've been seeing recently. And this is also why some individuals are asking, well, do we have to get this vaccine yearly? Or do we have to get another dose of this vaccine to help protect us against some of these variants? So when I say variant, it's basically a mutation of the COVID-19 vaccine. And currently we have 3 known ones identified in the United Kingdom, South Africa, and Brazil. So our current Pfizer and Moderna vaccines, along with the other vaccines that are kind of still in development and going through testing phases, have started to look at testing, their vaccines against these various variants so that we can gain some information around how effective is the Pfizer vaccine against the United Kingdom variant. How effective is the Moderna vaccine against the South African variant? And so we're actively doing that research right now to find those answers. These variants, as I said, recently were recently detected. So the South African variant was detected in early October 2020. And the United Kingdom variant was detected in December 2020. So if you think about it, these are things that are being identified very quickly, but we're also taking the vaccines that we have on the market right now and trying to determine if they will be effective against these variants. So it's one of those to be continued, to be determined, to understand whether or not we will have full protection. However, the goal is if we can continue vaccinating individuals against at least the variant that we know, COVID-19, with the products that we know are effective, we're hoping that we can start to reduce the transmission of individuals catching COVID-19 and therefore making it less likely for these other variants to be transmitted within the US. Unfortunately, we're seeing that these other variants do spread very quickly, even more quickly than the COVID-19 variant that we're familiar with. So that's why we really are acting fast to try and get individuals vaccinated. And so I know there have been some difficulties with that, and we'll talk about, well, how do you actually get vaccinated, and what is that experience like? So now that we've looked at safety of the vaccines and we've looked at, efficacy, does it work? So we're seeing these greater than 90%, efficacy rates and these significant reductions in transmissions. What are some of the side effects people who have received the vaccine? What are their experiences with it, and what are they experiencing that day afterwards? So right now, potential side effects on the arm where you got the shot. So you might be hearing people say injection site reaction. And so that's really looking at where you got your injection. People are experiencing pain and swelling at that site. That is a normal response to your injection, and that's nothing to be alarmed about. So when we think about other things that you may experience throughout the rest of your body, you might also have fever, chills, tiredness, and headache. And you might be wondering, well, why would I get something that's going to cause me to have all of these potential side effects? Fever, chills, tiredness, and headache doesn't make me excited, to run out and get my COVID vaccine. So when your body mounts that immune response, it can be felt in the sense of fever, chills, tiredness, and a headache. Individuals are seeing that if they have these symptoms, they last for up to 12 hours and then they subside. So once again, less than a full day of these symptoms. And these symptoms are usually very easily managed with over-the-counter medications or techniques. So if you do have that pain and the swelling at the site of your injection, the current recommendation is to apply a clean, cool, wet washcloth over that area. You could also apply ice to the area if the swelling is bad or if you're trying to reduce that pain or discomfort. The second thing that you should do is making sure that you continuously use or exercise your arm. Even though your arm may be a little sore and painful, it's important that you continue to utilize your arm throughout the day and to keep it in motion. As you keep your arm in motion, you're actually going to aid in that pain subsiding even quicker. So don't think just because my arm hurts that, I shouldn't move it at all. So we encourage you to continue moving that arm and to kind of work through that discomfort that you may have. If you do have a mild fever, we encourage you to drink plenty of fluids and to dress lightly. So if you're feeling hot, we don't want you to basically be sitting in a turtleneck and overheat. So we want you to dress lightly, try and be comfortable, making sure that you're not dehydrated and that you're drinking plenty of fluids. Other questions individuals have right now about the vaccine is this question of a severe anaphylactic response. So a severe response where an individual may have difficulty breathing or a severe allergic reaction. So we're seeing that this is happening very, very in very small amounts. So it's a rare event that occurs. But we do know that individuals who have an EpiPen or who have had some type of severe reaction in the past are at a higher risk for having that severe reaction. One thing that I want you to know is that each site or each place that is administering the COVID-19 vaccines, we are ready and prepared to respond to a type of reaction if that were to occur. So please don't think that if you were to have a severe reaction and you're receiving your vaccine in the community, that there's no one there who would be able to help you. Pharmacists, nurses, medical technicians, student pharmacists are all trained with CPR, and we're ready to have these emergency response protocols enacted so that we can respond appropriately should there be a severe medical need. And then lastly, I wanted to touch on the over-the-counter medication management. So if you were to have those chills or fever or pain still 12 hours after you receive your vaccine, you definitely can use any of these products that you probably have in your medicine cabinet at home or that you could pick up at your local pharmacy. So ibuprofen, aspirin, antihistamines such as Benadryl and acetaminophen. The current recommendation is for us to utilize these products after we have received the vaccine because there's currently some information that's showing that use of these products before you have your vaccine may actually alter or mitigate some of your vaccine effects within your body. So meaning there's questions around, could these products taken before you receive the vaccine make your vaccine less effective? And so we don't want to do anything that would make a vaccine less effective. And we want to be sure that we're getting, as much as we can from the vaccine. So these products should be used only after you receive your vaccine. And especially if you don't have any medical indication that would preclude you from using it. So if you know you're allergic to ibuprofen, don't use ibuprofen. You may need to use acetaminophen. If you know you have an acetaminophen allergy, you may need to use aspirin. So definitely understand what you can use based on your current health and manage your side effects appropriately. So today on the call, I do have two of our student pharmacists from Duquesne who have both received their COVID-19 vaccines. And so I wanted to invite them to give a brief synopsis or share really quickly about their vaccination experience. So Andrea, would you like to go first?
Thank you. Good evening, everybody. So just a little bit about my vaccine experience. I was able to receive the Pfizer vaccine through work. I had an appointment, so going in, the first thing you have to do is fill out a consent form, and on that consent form, it asks my basic information, and then it asks me some COVID screening questions, making sure I wasn't exposed to anybody, if I've had COVID in the past, just so the immunizer knows they can protect themselves more, and if I've had ever a serious reaction to a vaccine before, or have any allergies, and the immunizer would look over that, just make sure I'd be eligible to get the vaccine. My first dose after I got it, I did have a really sore arm, a little bit more sore than a flu shot, but it wasn't anything more than a day. And then 3 weeks later, I got my second dose of the Pfizer vaccine. I got that one around like 3 o'clock in the afternoon. And then right before bed, around like 10, 11 o'clock, I did actually get a little bit of a fever and had a headache. And then like the next 2, 3 days, I had some body aches and was a little bit tired, but nothing past 2, 3 days. And then now it's been a month since my second dose and I haven't had any effects after that.
Great, thank you. And Taylor.
Hi, everyone. So I was fortunate enough to receive my vaccine through the Allegheny Health Department. They'd set up clinics at Duquesne University, which is where I also helped volunteer at, and then they had some extra doses, so I decided to get one. So I had the Moderna vaccine. So I got it middle of January, I think it was, and then I actually just recently had my second vaccine last week. So I had to wait that 28-day period because it was the Moderna one. After the first dose, kind of similar to Andrea, I did get a sore arm and I was a little fatigued more than normal, but that did pass. And then the second dose is I had similar symptoms to Andrea, fatigue, headache, body aches. I didn't actually spike a fever, but I kind of had feverish symptoms, chills, and body aches, things like that. As far as the registration process goes, at least with the Allegheny Health Department, it was pretty easy to navigate. You just fill out basic information, name, birthday, email address, things like that. And then you also have to answer screening questions. So if you've been exposed or if you have any immunocompromising conditions, things like that. Just so, as Andrea said, the immunizer knows kind of what they're expecting before they give you the vaccine. But other than that, it was a pretty easy experience and only lasted a day or two, and then I was fine. And it's been about a week and I feel fine now. So yes, get the vaccine.
Thank you for sharing. So each of them did have those side effects, feverish, tiredness, injection site pain. But when we compare those side effects to individuals who've actually had COVID, we see that those side effects actually are very minimum compared to an individual who has the chance of actually receiving a severe COVID-19 diagnosis and experience. So when we think about that risk-benefit ratio, the risk is very small and that benefit is huge. Although you may have that initial discomfort that may need to be managed with over-the-counter products, those 3 days of discomfort potentially is better than potentially having to spend weeks in the hospital with a COVID diagnosis. And so that's really what we are, trying to advocate for, and really looking at the risk and harm reduction of individuals, in the health system, being admitted for COVID-19 and having to get that active treatment when we do have a vaccine that can mitigate some of that. So there was a question in the chat that says, what is on hand for an anaphylactic reaction if it occurs? So on hand, we always have epinephrine. So that might either be in a vial, for injection, or it might be the EpiPens. We always have, in terms of EpiPens, we have both the adult and usually the child doses if needed. And we also may have other things such as Benadryl, ice packs, a host of other things that may allow us to adequately respond to an individual who's actively having, a medical response to this. So that's a great question. Once again, all of the vaccinators are CPR trained. And so that's the other thing. We're not waiting for somebody to come who would be able to administer CPR. The individual who actually provided you your vaccine is able to provide that help and service to you. And the last thing that I would add, most of those serious vaccine effects happen within the first 15 minutes of you receiving it. And so for us, what we're doing is after a person receives the vaccine, we are keeping them at the site for 15 minutes and we're monitoring them. And we're doing that for their safety. So we don't want you to get your vaccine and leave and something happen to you. So we want to monitor you for those 15 minutes and 30 minutes if you've had a severe reaction before, to make sure that we are there to support and help you if needed. So the vaccine rollout plan. So you heard our two student pharmacists share their experiences. And so they were included in essentially healthcare personnel or individuals actively working with patients. So our student pharmacists in their 4th year are in the pharmacies, they're in the hospitals, learning how to provide that best patient care under the supervision of other pharmacists. So phase 1A targeted the long-term care residents. So you heard a lot of nursing homes being first tier on that list to receive the vaccine. And we also had healthcare personnel. We then saw that expanded to people 65 years old and older, and along with individuals with some of those high-risk conditions. So right now, we have a large number of individuals who are in this phase 1A patient population. And unfortunately, we are struggling with distributing the vaccine, not in terms of the people to give it, but in terms of us actually having some of the doses in stock. So right now there is, struggles just based on weather and shipments and delivery. We can have clinics scheduled, but we do have to make sure we actually have vaccines to administer while at those clinics. And so the question of, well, when are we going to get to the other phases is really difficult to ascertain. It's really based on how much vaccine can be produced and how quickly can we administer it to the 1A phase, and then eventually transitioning down to 1B, 1C, and phase 2. So I know that's very difficult for a lot of individuals who are eager to receive this vaccine. But right now, it really is that logistics piece of it and making sure that we have the actual resource in the vaccine to administer to people. High-risk individuals are being, prioritized because we are seeing that, if they do become infected with COVID-19, they're having worse outcomes. And so we're really targeting that increased risk population in that 65 and older patient population. All right, and so we're going to wrap up with discussing some reliable resources for vaccinations, so that if you have questions, if you're interested in finding out more information about the vaccines, where can you go to look? But also understanding some of the conversations that are happening in the community around how can people get the vaccine. So one of the next poll questions that I'm going to launch is, I can receive a COVID-19 vaccine for free. So this has been a question that a lot of people have had in terms of, well, when I do have the opportunity to sign up for a vaccine, is it going to be, can I afford it? Is it going to be something that's going to be costly? Or what if I don't have insurance? Am I eligible to receive this vaccine? All right, and we'll give it a couple more seconds. And these questions and concerns may come from other experiences where people have tried to get other vaccines and perhaps were told that they had to pay a co-payment or told that they had to pay an administration cost, and maybe they didn't have insurance, or maybe it was something that wasn't very affordable, and so it made it more difficult to receive other vaccines. All right, so there seems to be good alignment with everyone understanding that you can receive the COVID-19 vaccine for free. So when you do that registration, some forms may ask for you to input insurance information. If you do not have any insurance information, that does not keep you from getting the COVID-19 vaccine for free. So you are able to skip that section or put not applicable or choose that you don't have insurance and continue through the form. That does not mean that you're not eligible. Right now, it's a public health crisis, and so we are unable to deny somebody who is eligible and registered and have their appointment, deny them from getting the COVID-19 vaccine based on payment. That's not something we're doing, and so definitely don't want anyone to think that this is not accessible to them because they cannot afford it. The goal is for everyone to have the opportunity to be vaccinated. So looking at tools, information, and resources. So I mentioned that vaccines go through this clinical testing phased approach through the FDA. And after something has received authorization or approval, there's continuous collection of data to see is there long-term safety effects in what people are experiencing. So the CDC has created Be Safe, which is an app that can be downloaded to a phone, and it allows you to actually check in and provide your symptoms into the app. So it'll ask you how you're feeling, and you can actually tell or select the symptoms that you're experiencing. The CDC is able to collect all of this data, and then we'll be able to report back some of that long-term safety data and long-term side effect data that individuals are sharing. So it's one of those things that the CDC doesn't know people are having long-term effects if people don't share that information. So I encourage, once you do get your vaccine, to download the app and share that information so that it can be collected and utilized for research. Additionally, the Be Safe app also reminds you when it's time for your second dose. So whether that's 21 days or 28 days, it will tell you a reminder based on the vaccine that you received. I've also put links here for the CDC. The CDC really is, I would say, the landing ground for much of the information that is coming out, and it is a validated source. The Center for Medicare and Medicaid Services has information regarding payment. And so we've talked about individuals are not being denied access to this vaccine based on payment. And then the PA Department of Health is providing information regarding those rollout phases. So that's where you'll find information regarding who's eligible for a vaccine or who's eligible in which phases. But you'll also find information there about signing up to receive vaccines in locations that may have vaccines available. So I have one more question that I wanted to launch, and it's looking at that post-vaccine administration. So I mentioned briefly that you could actually still transmit COVID-19 if you were to become infected while not fully vaccinated. All right. So after I receive the COVID-19 vaccine, I no longer need a mask to socially distance or quarantine if I've been exposed. So when we look at this question, there are a couple different pieces to it. So if you've received the COVID-19 vaccine, you want to make sure that you wait those 14 days in order to gain your full immunity after your second dose. After those 14 days, you do still need to wear a mask and socially distance, because there are very few people in the population who have actually had the vaccine. And so until we are able to have a larger number of people vaccinated, we still need to mask and socially distance. Now, when it comes to quarantining, that one is actually under consideration right now. And so there's this idea that once you're 14 days past your second dose, and there's this assumption that you've reached an immunity level, if you've had a positive exposure to somebody with COVID-19, you may no longer need to quarantine for those next 14 days. So that is a recent development, and that's something to kind of stay tuned with. But once you receive your vaccine, it definitely is not, time to throw away all of your mask and to, attend the latest and greatest party. We still want to have these safety precautions as we continue to learn and vaccinate more of the population. So as we continue to mask up and stay 6 feet apart and avoid crowds, I did want to hit on once again some of those other poll questions that sometimes individuals are wondering about regarding the COVID-19 vaccine. So specifically around pregnancy. So although the COVID-19 vaccines for Pfizer and Moderna did not include pregnant individuals within their clinical trials initially, there has been nothing seen that would show that pregnant individuals are at a higher risk for increased side effects or adverse effects if they do receive the COVID-19 vaccine. And there also has been no shown harm to a fetus. Additionally, there has been no data shown that if you receive the COVID-19 vaccine that you will have fertility issues in the future. So we actually do have a large number of pregnant individuals who have been receiving the vaccine. And there's currently studies going on now that are more recent that is looking at pregnant patients and understanding if there are any effects on the fetus and if there's any infertility in the future. The question of, can I get COVID-19 from the COVID-19 vaccine? The answer is no. The vaccine will not give you COVID-19. But the caveat is, even if you receive the vaccine, if you haven't waited that total time, for your body to mount that immune response, you're still susceptible to contracting the COVID-19. And so we want to make sure that even if you've had your initial dose, that you're still wearing your mask and you're staying 6 feet apart because you're still at risk. The question of, if I've had COVID-19, I don't need to receive this vaccine. So that is untrue. So the recommendation is, if you've had COVID-19, that you need to wait those 90 days. But once you've waited your 90 days, you're eligible to receive this vaccine, and we would encourage you to receive the vaccine. And then we did have one more question in the chat, and it's around individuals who are recipients of transplants. Are they at a higher risk, or should they be more concerned with side effects? So that's actually something I would need to look into. It would really, when we're looking at side effects, we're trying to understand in terms of an anaphylactic response, have you had one of those serious adverse effects before? And then if you are a transplant recipient, it would really be partnering with your doctor to understand, if you were to have those side effects, what's the best thing that you could do to manage it? So based on the medications that you currently take, and based on your current, regimen, what are you eligible to take or to do to manage your side effects? So that is a great question. I would recommend that you partner with, either a pharmacist who is dispensing your medications and get their insight based on the medications that you're on. So I hope this was informative for everybody. We do have a few moments for questions if there are any additional questions. And I would like to thank you for your time and your engagement this evening.
So it might take just a couple seconds for our Facebook Live feed to catch up and let people know that we're closing out. And for final questions, I am wondering though, if you wouldn't mind, would you be able to review again just how, if people are interested in getting the vaccine, how they might be able to schedule and access that? I know that just in general, especially with the pandemic, there's huge concerns and huge showings that our Black and Brown communities, were disproportionately affected. And so there's also huge concerns that these communities also have the greatest barriers in receiving the vaccine and being able to schedule. So I'm just wondering if maybe you could touch base on that a little bit.
Yeah, absolutely. So I think, our vaccine distribution plan throughout the United States definitely had room for improvement. This initial push for all scheduling to be done online was definitely a barrier. Not only to Black and Brown communities, but for that 65 and older population who were being prioritized. We were forcing them, to utilize technology that they weren't familiar with. I know my own grandmother in her 80s in Alabama called me and asked me to schedule her an appointment for her vaccine. And so that's a red flag. It lets us know that it's not accessible to people we are identifying as the most high risk and the people who should be prioritized. Within the state of Pennsylvania, Governor Wolf did put out a mandate that all individuals who are, currently scheduling for the COVID-19 vaccine need to have a way to schedule those appointments via phone and not only via those online processes. So any site that you may hear of that has a scheduling mechanism should have a phone number available for residents to call and schedule an appointment. That statewide number or hotline for people to call is 211 in the state of Pennsylvania, and that can provide you information on how to sign up at different locations. And it can also provide you information regarding, eligibility and things to expect with COVID as well. Allegheny Health Department is working really hard to have a lot of clinics stood up, not only at some of the larger sites, but specifically in these Black and Brown communities. I know some of the federally qualified health centers are on the list to get vaccines very soon. And I believe we will have some clinics in Hazelwood starting as soon as this weekend to have individuals able to get their vaccine. So that's definitely something we're excited about. And I think everyone has acknowledged that the scheduling has been a breakdown, for everybody, really.
I believe there was one more question in the chat. They were asking, is there any info on those who get the vaccine that have autoimmune issues? Does it make them worse or add any more autoimmune issues?
So autoimmune individuals were originally excluded from the trials that were done, but with that post-vaccine, data collection and surveillance and some other smaller studies that have spun off, there have not been a significant number of individuals having, increased side effects who do have autoimmune issues. Things that we want to think about with autoimmune issues are the specific medications that you're on that may be utilized to manage whatever autoimmune disease or issue that you may have. And that's something that we would also consider in determining how well the vaccine will work in your body. Sometimes there is this concern that if you are autoimmune, your body may not be able to mount that immune response needed when it's given a vaccine. And so that's one of those concerns that we can look at based on your medications to determine how well will a vaccine work for you. And then I did see one more question about what if I do have an EpiPen because of allergies or a transplant. If you are an individual who has an EpiPen, who's had severe reactions, and for this person specifically who is a transplant recipient, I would just make sure that you are partnering with your doctor to make sure that they're aware that you are getting your COVID-19 vaccine. And for an individual such as yourself, you may actually want to have your vaccine in more of a clinical location. So that could be on site, at a hospital clinic that is administering the vaccine. That way they do have more resources available if needed for a severe response. And so that's definitely something that you would consider. At a minimum, if you have an EpiPen, if you've had severe reactions, you should be monitored for 30 minutes. So if you've had those experiences, you're no longer only monitored for 15. At a minimum, we want to watch you for those 30 minutes to make sure that you're going to be okay after you've received your vaccine. Kiyomi, were there any other questions in the Facebook live chat?
Nope, just a whole lot of thank yous and signs of appreciation for you. So thank you so much. As we're ending here, a whole lot of thank yous are coming in, a lot of thumbs up and lots of love signals. So thank you so much for your time on that. As we're kind of saying goodbye, if there's any other last questions that pop up in the Q&A, please put those in now. But I know I learned a whole lot. I am so appreciative of you in this time. And thank you, Andrea and Taylor, for coming on and also sharing your experiences. Devon, do you have anything else that you'd like to add for closing remarks?
I'd just like to thank everyone. Thank you, Dr. Hatcher, for a wonderful presentation. Thank you, Taylor, Andrea. Just thank you guys for your information. I know this is going to help many people. So I just wanted to say thank you. And thank you, everyone who joined with us tonight.
And one last thing, I just want to empower everyone. Don't be afraid to ask questions. If you're unsure, ask those questions, receive the answers that you're looking for. And as I said, we don't have answers to everything, but you're allowed to have those questions and they should never be dismissed. And if you feel like you're being dismissed, I would encourage you to find a provider who you feel like is listening to you and able to answer those questions for you.
Great. Thank you so So much again for coming on and having this information session with us. Again, thank yous to Dr. Hatcher and to Andrea and Taylor and Duquesne University. Also, thank you to our closed captioner that was keeping up with us and being able to provide that services for all of our community. I think we're all finished with the questions. So this will be recorded. So we will also share this on our YouTube page for anybody that missed it on our Facebook live feed or missed it here live off of Zoom. So we will post that as soon as that uploads. And certainly if you have any other questions, please put them in the chat and we can forward them on and research some of those answers for you. Thank you so much for joining us.
Have a good night, everyone.